All right, welcome everybody. Very excited to be with you here today. We have Liz Lull. Welcome, Liz.
Thank you. Thank you.
Yes, and for those of you who don't know her, she is a huge staple in the birth community right now. Owner and founder of Enlightened Mama, a fabulous organization, fabulous business in our community. We love having her part of the community. She has lots of credentials. She's on the international board as a certified lactation consultant, birth doula, craniosacral therapist, even Lamaze educator and trainer as well. I know she does birth doula training. And on the University of California, San Diego, she teaches lactation there as well. So, as I said, a really well-rounded resource for the pregnant mamas in our community and right after pregnancy as well. So, today we're going to talk about helping your baby feel super comfortable, getting them off to a good start. And make sure you stay tuned. Next month, we're going to focus more on the lactation side of things. But we know that birth can be a challenge. Even a smooth birth is a lot of stress for a newborn to go through. I know in our office we see a lot of babies after they've had a really stressful delivery. So why don't we, for today then, Liz, we'll be talking about the craniosacral side of things
Yeah.
and how crucial that can be for a newborn. But for a parent out there who's maybe heard the term craniosacral, but they're not quite sure what it is, can you start with an overview of what it actually is and some of the benefits that parents will see with craniosacral for their child?
Yeah, definitely. So, I mean, when we're talking about it with families, talk about body work. And so usually we'll kind of bring in the idea of chiropractic and massage, which a lot of people are familiar with, and then craniosacral into that. And so, us specifically, we do the craniosacral piece and some myofascial unwinding. And so we talk a lot about how, massage can get into the muscle the muscle, and the chiropractic can kind of get into the bone and the vertebrae. And then this is working on sort of that outer layer, that fascia. And specific with the craniosacral piece is creating that balance between the cranium and the sacrum and making sure that the cerebral spinal fluid can flow freely, because we kind of talk about like that's the vehicle for all of the messages to get to, the organs, the muscles, the bones, everything that needs to move. And especially with babies who have been fairly passive in the way that they've been existing in the womb, they come out and there's a lot of things that babies have to do and a lot of coordinated responses that have to happen in the body, many of which happen in a very short amount of time right after birth. But some of them we see can kind of take a little while for some of these primitive reflexes to get integrated and things like that. And so it's really important that there is balance in that craniosacral system, and mainly with babies because of what they've just gone through is having all of their cranial plates sort of overlapping one another in order to come out in a vaginal birth. And even in a cesarean birth, we have babies whose heads and necks are pulled and torqued, and those cranial plates, which are designed and meant to be overlapping, now are put in this sort of state of trauma from the mode of birth that we know some babies need to be born that way. And so we just have to look and see kind of like what has this baby gone through that might have created this state of imbalance in their body, and how can we get them back to where they need to be.
Got it. Okay. And when you talk about some of the things that as a baby's transitioning from being in the womb to now being out in the world, and the cranium and the sacrum at the base, and that connection, some of the things that the baby needs that for would be nursing, pooping, sleeping. What are those some of the key examples there?
I mean, absolutely. So we look, I mean, because we're lactation consultants, that's sort of our biggest thing, saying, can this baby suck? We're looking at that coordinated responses, the suck, swallow, breathe, which are things that are really incredibly important, obviously, for the baby's existence. So we have babies too that will have basically zero suck response and suck reflex, which can be really dangerous for a baby. And so we are looking at that. We're also then looking at things like, how are they coordinating that respiration, which has been something they haven't had to do in the womb, but now they need to do on the outside. So are they having any issues with that? We also look a lot at digestion, which is another big piece that babies haven't had to do a whole lot of when they're in the womb, and now they come out. And so even when we look at people who are concerned about things like reflux with their baby, they're spitting up a lot, fussiness, gassiness, things like that, which some of those are sort of like babies have to get used to the normal feelings of digestion, right? But some of it becomes a problem for families, and they're trying to fix this, where it's like, hey, if we could just kind of restore this normal state of balance, or making sure that all the proper signals are getting to the digestive tract, then babies can make that transition a little bit easier,
Got it.
like
Yeah.
from the outside.
Definitely. And I think that's such a huge thing to keep in mind is babies should have a pretty easy life, right? They don't have a ton of bills to pay or work to show up to or homework. But if those things are off, that it's just going to impede with that natural ability of what a baby is designed to do.
Yeah, exactly. We see these little babies that come out and are really, really stiff and rigid. And you think again, like, what's happened in your life that was so traumatic that you have so much tension in your body? And it really just is that. It's really just they grew up in a really tiny, cramped space, and every single person has a different womb, a different uterus, different pelvis, and babies can get lodged in there. We have, multiples or things like that where their space is even tighter. And then, of course, we look at their birth story and what was that like. And so we address, that sort of, trauma that is associated with birth. But babies are great in the sense that their only big life events that have ever happened are being in the womb and coming out of it. And so we love working on babies because you fix them and they're just like, oh, thank you. And the baby's never going to have that repetitive injury of going through the vagina ever again. Mm-hmm. So they're a lot easier than adults who, play sports or, work on their computers repetitively so you can fix them, right? And then they're like, now you're right back because you kept doing that. But babies don't do that. So they're easy and very, very resilient because we just help to get their body in the state of where it's supposed to be. So we're not doing anything. We're not forcing the body into a position or a state where it wasn't intended to be. Quite the opposite. So we're trying to put it back to where it's supposed to be with really, really gentle touch.
And that's what I think is important to emphasize is that there might be a lot of stress for a baby to be born, but they want so bad to be in that natural state.
Right.
It doesn't take a big stress to reset them.
Exactly.
Right? So how can you describe a little bit of the craniosacral process? If a mom brings her baby to you, what would you be doing? What would you be looking for? How gentle is it?
Yeah. Mm-hmm. So, I happen to have a fake little baby right here, right? Our little baby. So this baby is incredibly rigid, right? So we're looking like, we don't want a baby like this. We don't want a baby that's standing up. Some people will think their baby's really strong if they can stand up when they're 2 months. We're like, actually, they're not supposed to be doing that developmentally. They're really tight. So we're looking at, how is that baby? We always, because we're seeing these people typically with breastfeeding issues, we'll often do an oral exam and looking at the baby and seeing, is the baby sucking? Because that's one of the most important things to figure out. Is this baby even getting that very basic signal that they should have been practicing in the womb months ago? So we'll do an oral exam on the baby, with a gloved finger and kind of look and feel for things. We feel for the palate, because that's part of the cranial bones, right, in the structure there. So feel, is there any blockage there, any restriction there, which we can usually pick up pretty readily. So then we'll often, after we kind of do an oral exam, we like to work from the bottom up. So we start with the baby's sacrum. Often we can do work with the baby lying down. Some babies don't want to lay down because they have that really strong strobel reflex. We actually will adjust their sacrum sitting up and kind of hold them and do a little work to adjust the sacral area because this is all interconnected. And so this connects up around the dura and of the brain and things like that can connect to the nerves in the back of the tongue. So if that baby's not sucking, it might be that they actually have a restriction in the sacrum and we can release that. And then they can start doing the things that they're supposed to be doing. So we usually with babies will do kind of a bottom up approach because we also think of like that's how they came, right? They were coming usually head down and the pressure started actually on their sacrum. So when the uterus is contracting, that's when the pressure starts and then it's going down their body. And so we'll look and see is there restriction in the sacrum. And then we look into that respiratory diaphragm. So seeing, this baby that might sound kind of wheezy when they're breathing. So that might be a baby that has a little bit of restriction as far as getting all their secretions down, their fluids down. And is there some kind of leftover from that big squeeze that was supposed to take place when they came out of the vagina? So we'll work there. And then we'll go up into the occiput because that's, again, the base of a lot of these things, those cranial nerves to control the tongue. And then eventually kind of work more on the top. And so, usually it's nice, I feel like when we do this too, is that we've kind of established that trust and a lot of people are a little bit nervous about you doing stuff with their baby's head and like, oh gosh, I don't want to touch it. And they're just, they're nervous because babies have those fontanelles, those soft spots. And so I think we kind of establish that trust in that relationship and we are communicating with the baby the whole entire time and really assuring the baby that we're not going to do anything to hurt them, that they are safe. Because babies often will have these really big emotional responses when we're working on them, especially like we get into like the psoas muscles down here and things like that are really tight. And because babies can't say, oh wow, that's really tender, they just squawk and scream. And so we have to really assure them that they're safe and that we're not going to harm them. And then we kind of can get into the head and and do a lot more work. And again, we end up doing a lot of work too in the mouth as well, because that is our area of focus. So, but there often, if there is that restriction of the palate, sometimes that'll be the last thing that we do, even though we know that that's actually like the first thing we want to do. But some of these babies who are having issues, one of the biggest things we see is babies who are gagging a lot, and choking, can't take a pacifier, can't take a bottle. They might be struggling with feeding because then they're not getting enough of the breast tissue into their mouth. And so then we want to work on that first, but we have to kind of release everything else. And then that usually will open really, really easily within a matter of seconds, which is awesome.
That is awesome. I think it's something that we take for granted almost, as it should be so easy, so foundational for a baby to come out and nurse. And if there is birth trauma in that area, it's just like if you're playing a sport, you're playing basketball and you twist your ankle and suddenly it's pretty tough to walk because your ankle's injured.
Right.
But when there's that much stress in the birth process, it's like getting a sprain, strain, neck, mouth, face, teeth, lips, all those pieces. And
yeah. And sometimes we'll have babies that it's like the stress was from themselves, from maybe in the womb we see that they had a hand up like this, and so they've just been pushing on their jaw, and then we can see their whole face is lopsided, and maybe the birth went pretty easily, but then we look at it and say, oh, well, what was their in utero positioning? Or, we'd like, oh, this is exactly where your baby was laying on your pelvis. And the mom says, oh my gosh, yes, this is exactly what I felt. Or we've had a number of people that we've worked on that have had breech babies recently and have been fortunate enough to have breech vaginal births. However, that actually leaves a lot left for us to do, because that wasn't the intention of the baby to come out butt first. And so, like, oh, I can see exactly where this baby's head was stuck under your ribs. And she says, yep, that's what I felt the whole time. And so I feel like that's a really cool thing that we get to do too, is that we can look at the baby, we can talk to the family, see where have you been having issues. Okay, well, they can, even though their baby's adorable, right? I'm like, but you can see though that their face is kind of crooked or their nose is off to one side. And then we can kind of go back and say, let's talk about your pregnancy. Let's see how things were going. Where did you feel the kicks? Where did you feel the movement? And things like that. And then I think it really helps the family to connect. And then I think they have a little bit more of a buy-in to the practice that we're doing and the work we're doing, because then they're like, oh, okay, I see you guys know what you're talking about. And I think for us, because we have this history, we work as birth doulas, we work with people prenatally. It's like we get it all. Like, we can look very much big picture as to what's been going on now, but also where did this come from? How long has this been going on?
Definitely.
Birth trauma, was it, pregnancy trauma in essence?
Mm-hmm. Yeah, I think it's so important to do that detective work.
Yeah.
Just because there can be so much stress. I remember one family we had checked where they were twins, and partway through pregnancy, like for the whole last trimester, whatever it is, they didn't really move. They kind of got in their position, and that's where it was. So the baby down the bottom, you could see how scrunched she was relative to her sister on the top, just because she was growing and developing in that scrunched position.
Yeah.
And I think of it like a tree. If you're growing a tree and it's a little bit tilted early on, it's just going to keep growing crooked.
Exactly.
But if you can, instead of growing crooked, if you can start to straighten it out, now it has that potential to really develop and grow into what we want it to be.
Yeah, I mean, this is why we always say we're like breast detectives, because we are the ones that will kind of look at these cases and figure like, well, why isn't this working? Like, it's not normal for your baby not to suck. It's not normal for you to have pain and discomfort, and figuring out like, why is this happening? Why is maybe your baby not gaining weight? That you're trying and doing all these things. And so we often have people that will come to us, sort of as like after they've tried this or seen these other people, and we're like, oh, we just get back to the basics and the foundation, like you said, to kind of get your foundation straight, balanced, even, and then the rest just can take off from there.
Definitely. Yeah. And I think it's nice when you have so much experience. I know you have 4 kids of your own, so you have the personal experience, but just working with so many moms over so many years, like you said, you get to see as baby stuck a certain way, if there was the difference between a vaginal birth and a C-section birth, the different stresses that puts on the baby.
Yeah.
And so many factors that are involved to really like do your homework, do your detective work, and get to that exact thing the baby needs. That's so wonderful to have that experience.
Yeah, I mean, and one of the things that we find too is that in our detective work, sometimes it's not even the baby. Sometimes we're having to figure out what was the pregnancy like for that parent. And so it's really interesting when we look at stress and trauma. And we had a baby we worked on for a long time that, we asked, was there any accidents? And this mom had been in a car accident when she was pregnant. And and had hit a deer or something like that. And she said from that moment, she felt her baby scooched up and the baby was almost like the baby was afraid. And the baby then ended up never going head down. The baby was born a cesarean from breech position. And this was that baby that was this like stiff as a board little baby that we had to work through what was actually trauma for the mom because she was the one that went through that. But then the baby got that passed on from, and there's stress hormones that are released in the parent that then get passed on to the baby. And so we had to work through a lot of that. Or we've had people, stress from work or, family things. We've had, people lose their parents or whatever it might be. And so a lot of times once we kind of look at the baby and say, okay, like I see this is what's going on. We talked to the person that carried the baby and said, hey, can you tell me what this was like? And that's where often we were peeling back the layers. And the interesting thing about that sometimes too is we see as that mom or that parent is processing their own emotions, that then the baby will start crying and they're like, yes, this is it. It's like, it's like, we have to release that. And like, tell them like, that's not your stuff to hang on to. So, this is why we really like the craniosacral piece too, is that it allows for these big emotional responses. And we know that pregnancy is emotional. Even when people love it and enjoy it and are so thrilled to have a baby, having a new baby, being a parent is really emotionally stressful, difficult times. And so it's nice to do this work that allows things to just sort of leave the body without, I don't know, 30 years of therapy, it's like, tell me necessarily what's going on. It's like sometimes we can see.
And that's, I love too, is because I find that, like you mentioned, where families are coming to see you after being all these places, and we see the same thing. And they've been all these places because they don't actually have a reason as to why their child's struggling.
Right.
And when you can do that deeper work and help them connect the dots, it's so empowering, especially as a new parent, where you're just trying to feel out the ropes of how to raise this little child in front of you. When you actually can connect the dots and say, oh, this is why he's tight as a board, or this is why she has reflux, or whatever it might be, it's just so empowering as a parent to know that there's a reason for things.
Right. Because I think that lots of people sort of just get swept up into, the medical community and says like, oh, this is how it has to be. Or, we have lots of people that say, oh, well, breastfeeding just didn't work for me. It's like, well, that's really not how it's designed to be. I mean, humans have survived for a long time nursing their babies, just like other animal species. And so we want people not to just accept that as sort of, well, this is just what happened for me. Like there's almost always a reason why.
Right.
It's
not always easy to find, but we know when you have enough experience and you can do enough digging, like eventually you're going to figure it out. And like you said too, when you have a new baby that doesn't have 30 years of stress, when you do figure it out, usually it's pretty quick, and you see that response. You see the baby open up. You see them getting calmer, sleeping much longer than they used to, just latching on, nursing, and it's so rewarding to get that change.
Oh, absolutely. Absolutely.
Yeah. What would you say with craniosacral out there, what would make you guys different than some of the other approaches to craniosacral or some of the other therapists or
organizations out there? The training that we have, and so it's myself and Gigi, who is my wife and partner, and then we have another craniosacral therapist, Landon, who is starting to work for us doing this work. All of us were trained with Dr. Carol Phillips, who is a chiropractor to start, and then she took the craniosacral training many moons ago, and then incorporating into that myofascial release. And so we do that, and her training is called dynamic body balancing. And so doing this work, incorporating the fascia and looking for torsion and things like that, it allows the work to actually happen a lot faster than traditional craniosacral therapy. So traditional craniosacral therapy is, like laying your hands on the cranium and working the plates and holding them there and waiting and waiting and waiting and waiting and waiting. And then eventually they go. Or we can look and say, oh, hey, actually if the torsion is in the fascia, maybe I'm going to unwind your sacrum or release your left leg, and then that's going to release the pull over here, and now the cranium can move a lot faster. So I would say that that's a big piece of it, that the work happens faster. For us specifically, having that birth background, having that pregnancy background does allow it, as we're talking more about digging into the story and really giving people that safe space to share it, because a lot of this journey is emotional. And so, being birth doulas and knowing about emotional support and tapping into the mind of a new parent, I think gives us a little bit more of a caring and understanding approach to it. Again, as you said, having 4 kids, myself, all with their own challenges, it definitely kind of can be empathetic with families and help them navigate through this. And then I think just sort of looking at the ways that we approach it, the way that we spend time with people is very different. But we also are always trying to work ourselves out of a job. And so we are very, very adamant about we teach families the exercises. We show them what to do. And so which is great so that they can feel, again, like you talked about, feeling empowered to know the answer, but now we're going to empower you to actually be able to do something about it so that you don't have to leave your house and come and see us because, pretty soon the snow is going to fly and there's little babies. I don't want you traveling across the metro area. If we could just do this stuff and you can work on your baby yourself because they're the ones who are with the baby all the time. And so we love to get, parents, partners involved, grandma, whoever is going to be caring for this baby. We'll show them little things to do that we will start the process of this movement and realignment, but then they get to finish it and keep working and then hope that it doesn't come back, and so that's one thing I think that is different than a lot of other people. People aren't getting exercises or getting that like, oh, come back and see me, every single week. It's like, no, I don't need to see that. As much as we love the people we work with, we don't need to do that because there's more babies that need more help. So
for sure. And I think that not only the empowerment that comes with that, but the level of connection.
Right.
And, you're now spending more time with your baby in that really intimate way.
Right.
As a new parent, you're observing every little nuance about the baby anyway, but now when you can actually start to learn how to help the baby out as a mom or a dad, it just really deepens that connection.
Yeah, we're constantly telling people it's like stop reading books, stop reading blogs, just read your baby, spend time with them. And so if we can, again, uncover why the baby is the way that they are, why they're struggling, then now we're going to give you the tools and then you're going to fix it. Then they are like, oh, yes, I did something without reading a blog, which is amazing. Raising kids for years and years and years without the internet and apps and things like that. So we really try to help people just sort of get back to the roots of their, like you said, the connection with the parenting and trusting their instincts because there's something in their instinct that led them to us. And so we want to help tap into that. There's a reason why they didn't listen to that person. Like something doesn't feel right. And so I'm a huge believer in trusting parental instincts. And part of that comes from helping them to spend that time to look at their baby, to engage, to connect, to work with them.
Definitely. Yeah, we talk all the time about helping, even if you're a new parent, like you have such a instinct that just knows so often, right? And if you're led to a certain practitioner, a certain service, whatever it might be, and the first time you see your baby being worked on, and you just like get this sense like, yep, that's good for my baby. Yeah. I might not be able to put my finger on it, but I know they're in a good spot.
Right. Because like there's a lot of the work that we do where it's like, what are you even doing? It's like some of it is like you just, it's so deep yet so light at the same time that it is really, really powerful.
Yeah, and that's what I love about when you're talking about the fascia piece with the craniosacral and actually looking more for the root. That maybe there's an area that's tense, but it's being caused by the leg down low. And when you can get to the root of that and unwind, you just have such a deeper impact.
Yeah.
It's wonderful.
Yeah.
Yeah, all right. So as we're wrapping up here today, we can put your contact info in the comments section below.
Yeah.
Is there any best way that people do get a hold of you guys?
Yeah, so honestly, my cell phone number is the best one, and it freaks people out sometimes. It's like, yes, call my cell phone because it's the easiest, most direct communication. So calling or texting me is the easiest and fastest way. And then we try to get out to help people, because we have this good team that we can usually get to see people within a day or two. So
wonderful. And I know that can be a huge piece with newborns is just that urgency and trying to get to the root of things right away rather than having a baby that's up all night crying and mom's losing sleep.
Absolutely. We see babies as soon as, we've worked on brand new babies that are a few hours old. And then we can work on toddlers, kids, so the benefits are not just the newborn, but we can do all ages.
Definitely. Yeah. That's, I think, one thing too. I know we talked a lot about babies in this interview, but it's something that these stress patterns, maybe they were never addressed when young, or they're adding up because of other stresses later in life. So it's a great avenue and approach for the whole family.
Yeah, exactly.
Wonderful. Well, thank you so much, Liz. I will, if I have your permission, then I'll put your cell phone in the comments below as well for people on the website.
Enlightenedmama.com is our website, so there's more info, and then a link to schedule and everything is there
Wonderful.
on Facebook. So
Sounds good. Well, thank you so much, and we look forward to talking next month. We'll go into more tips and strategies specifically around the lactation part. So,
okay, sounds good.
well,
Thanks.
thank you, everyone. We'll talk to you guys later.